Welcome to another Sjogren's and Gut Care series. My name is Cristina Montoya. I'm a registered dietitian and a Sjogren's advocate. Today I bring to you Fact versus Fiction Digestive Enzymes for Sjogren's. If you haven't met me yet, I'm a mom, wife, dietitian in both Colombia and Canada. I've been a Sjogren's and rheumatoid arthritis warrior for more than 20 years, but Sjogren's was my first autoimmune love that started when I was a kid, and I really don't know a life without Sjogren's. I help women with RA and Sjogren's take control of their gut health, and I also help them to adopt an anti inflammatory lifestyle without unnecessary restrictions. I've been committed to raise awareness about the effects of Sjogren's on digestive health since 2022. I've been participating in scientific meetings and summits. I also create recipes and lifestyle articles for the Arthritis Society of Canada and the Sjogren Society of Canada since 2020. I'm currently working on updating my website, so hopefully it will be ready in the next couple of months. Today's objectives are that you will learn about digestive enzymes and normal digestion process. What is the impact of Sjogren's on digestion, and recognize symptoms of exocrine pancreatic insufficiency and when to seek further medical attention. Also, we'll speak about some of the over-the-counter enzyme supplements. As a reminder, the information and products shown in this presentation are for educational purposes only and should not substitute the specific advice from your physician or healthcare provider. I am not endorsing any of these products, and I'm not getting any financial gain from the products shown here. This is just for you to reflect on what brought you here today. Have you ever felt overwhelmed by the variety of digestive aids at the pharmacy or health food stores? Well, I have. Before we delve into the topic of digestive enzymes, let's take a moment to review what they actually are. So, digestive enzymes are a type of proteins that help break down food into simple molecules that can be absorbed and utilized. Digestive enzymes are like molecular scissors. So, that was a great analogy by a dietitian that presented a great summary of digestive enzymes for IBS. We start breaking down food into molecules from the moment we put foods in our mouths. The body really contains like three main categories of enzymes: those that break down carbohydrates, break down proteins, and break down fats. The digestion process requires the interaction of many digestive enzymes localized across the GI tract, primarily produced and secreted by the pancreas. So now we need to learn about what's normal and expected from our bodies so we can recognize when something isn't working properly. Some fun facts about the gastrointestinal tract is a long tube about 30 feet long or 9 meters. So picture this: a beach volleyball net. That's the size of your gastrointestinal tract. Each section of the GI tract requires a specific acidic alkaline environment to function properly. So whenever people tell you you need to try an alkaline diet, it is really nonsense because once you consume those foods, you're going to go into an acidic environment. So it's not going to make any difference. There are also auxiliary glands that aid digestion, like salivary gland, liver, and gallbladder, and pancreas. The GI tract is the second largest organ in the human body following the skin. So that's why we need to take care of it. In the mouth, we turn food into small pieces with the help of the teeth and saliva. Saliva contains salivary alpha amylase and lingual lipase, which starts the digestion process of starch and fat. So it usually starts the digestion process of large molecules. The esophagus carries food from the mouth to the stomach, and in the stomach, which is our own high power blender, mixes food and gastric juice for digestion. There are specific cells in the stomach that help secrete certain hormones that helps to secrete the acid, the gastric acid, also other molecules like the intrinsic factor that is essential for B12 absorption. In the stomach, we also start the process of breaking down protein and fats, but all the magic really happens is in the small intestine, especially duodenum. And that's where the pancreas releases all the pancreatic juice containing the digestive enzymes that's going to help break down the proteins, fats, and carbohydrates and also aid with the absorption of it. The liver is also important because they produce bile, which is a solution produced by the liver and stored in the gallbladder that facilitates digestion and absorption of lipids, acting as an emulsifier. Even though it's not an enzyme, it is necessary to help, kind of mix up all these fats. So when the pancreatic enzymes acts on, it's easier to act on these fats, and the surface is easier to access. Then the large intestine, now we know how important it is because it harbors all of our gut microbiome that produce the enzymes to break down dietary fibers and metabolize bile salts and pancreatic enzymes. Additionally, the colon houses bacteria that synthesize essential vitamins like niacin, vitamin B1, and vitamin K. So now, what is the impact of Sjogren's on digestion? And I insist it's huge because individuals with Sjogren's have a disadvantage in terms of digestion as the process begins in the mouth. Saliva is responsible for initiating the digestion of carbohydrates and fats using salivary amylase and lingual lipase. And our saliva is poor in quality and quantity. So even if you're producing sufficient saliva, there's no guarantee that is a good quality. And the reality is that 95% of individuals with Sjogren's will develop dry mouth due to hyposalivation at some point in their Sjogren's journey. Sjogren's increases the risk of a condition called atrophic gastritis, which can cause the stomach to produce less gastric acid. This can lead to problems with digesting proteins and absorbing vitamin B12. So ask your doctor to check for atrophic gastritis during your next endoscopy. And what really is our focus today? Up to 10 to 30% of individuals with Sjogren's may experience exocrine pancreatic insufficiency, and this is more as a manifestation of Sjogren's because the literature tells us that Sjogren's attacks the moisture producing glands or exocrine glands, and the pancreas is a big one. So often people are diagnosed with IBS predominant diarrhea, where the culprit may be an actual exocrine pancreatic insufficiency or EPI. This is a recent review done in Colombia by gastroenterologists and rheumatologists. What I really loved about this is that the authors acknowledge that Sjogren's is not limited to dryness and can cause a wide range of gastrointestinal symptoms such as dysmotility, hypochlorhydria, and other conditions just like you see here. They they said that these conditions may have varying clinical presentations and can be misdiagnosed if not approached correctly. One thing that they failed to do was to describe the impact of autonomic dysfunction on gastrointestinal function, although they did touch on that when it came to the saliva secretion and esophageal dysmotility. So, what is exocrine pancreatic insufficiency? And what is the role of digestive enzymes supplementation? The EPI is basically when your pancreas cannot produce sufficient enzymes for digesting and absorbing nutrients. This is a diagnosis that is usually done by your gastroenterologist. Patients with EPI may present with signs and symptoms similar to other GI conditions such as diarrhea, abdominal pain, bloating, excessive gas, and most importantly, unexplained weight loss. So you're not expecting to lose weight, and steatorrhea, so those very smelly, greasy, oily stools. And one way to recognize those oily stools is when the stools get kind of stuck in the toilet bowl or they start floating. That's the most common clinical manifestation of EPI, but it may not appear until the disease is advanced. So, a great resource to learn more about EPI is identifyepi.com. I highly recommend it. EPI also may be present in other medical conditions like cystic fibrosis, chronic pancreatitis, pancreatic insufficiency, or even surgical removal or parts of the pancreas or due to cancer or injury. Some individuals with inflammatory bowel disease, like Crohn's disease, may also have some EPI. What I review in literature is that EPI diagnosis is mostly a clinical diagnosis. So they will look into all the symptoms. They will monitor your weight. They might test for fat soluble vitamins, maybe order a fecal Sudan stain test where they use a microscopic examination of stool using that Sudan stain to detect fat, and it's the best screening test for malabsorption. So you don't need a stool sample for this. So then why not ask for a fecal elastase as well? This test is also done to look for an enzyme called elastase that is released from the pancreas during digestion. So normally this enzyme will be found in your stools, and if little or none is found, it can be a sign of EPI. Or maybe a quicker way to assess whether you have EPI or not is that they will do a trial of pancreatic enzyme replacement therapy. So managing EPI is with PERT. These are made of glands of pigs because the tissue really mimics the tissue of like humans, and they seem to be the more efficient. Then we have the lifestyle, so it's a well balanced diet. Frequent small meals is still preferred, avoiding or limit alcohol, stop smoking, and may or may not need to avoid fat or just reduce the amount. Then a supplementation with fat soluble vitamins is essential just because of the potential malabsorption that still may occur. So, pancreatic enzyme replacement therapy is really a prescription medicine that works by replacing the three pancreatic enzymes that are normally made by a healthy pancreas. So, lipase, amylase, and protease. This is an example, it's not the only option, but just to show you here what is this about. It must be taken with every meal and snack. It cannot be chewed, and because it has a special coating that can withstand the acidic environment, so then it can be released in the duodenum where all the absorption of nutrients occur. What is very interesting is that you need, according to the Creon guidelines, an adult with EPI who weighs over 110 pounds requires at least 36,000 lipase units. And I really want you to remember that number when we look at the over the counter digestive enzymes. Are you experiencing any of these symptoms? If you are, I highly recommend that you keep track of your symptoms for a week or two. After that, take it to your doctor and get a full GI examination. One, to rule out any other gut disorders, and two, to, if they had already done that, ask your doctor to test for EPI. Now, let's talk about the enzyme supplements that we can purchase over the counter. We will discuss some digestive enzymes that effectively aid digestion first. So, do you remember our discussion about FODMAPs? Well, we had an amazing webinar in January. So, hopefully, you got the link when you subscribe to my mailing list. And you haven't, please send me an email. FODMAP stands for the fermentables, oligos, disaccharides, monosaccharides, and polyols. They are carbohydrates that cannot be digested and absorbed, causing the trouble through your gut and be fermented by gut microbes. The enzymes. So, why is this important? Because the low FODMAP diet is becoming one of the like cornerstones of treatment for IBS, but it's not always effective, as up to like 25 to 50% of people may not really react positively to a low FODMAP diet. Also, it may be overly restrictive, and I know many patients already are restricting so many foods, hoping to improve the symptoms. So, one way to maybe have more like a food freedom, it's by using enzymes that work directly or specifically target the FODMAPs. The body doesn't naturally produce these enzymes, only the lactase. But during adulthood, the production of lactase decreases, as I mentioned in my second email. So this is again like just the full list of enzymes that can target FODMAPs. Now, so we have digestive enzymes on the market that act on specific foods containing oligosaccharides like fructans and galacto-oligosaccharides, and also other enzymes that can act on lactose and fructose. But there is no commercially made digestive enzymes to break down the polyols or sugars, alcohols like xylitol. Is that's really important to note because many of us consume xylitol through like sugar-free candy, lozenges, and sugar-free gum, and so many other products. Why is it important to really target these FODMAPs if you're intolerant? Because they are prebiotics, and just because you're breaking down the carbohydrates, it doesn't mean that the gut bacteria is not going to utilize it. It's just going to make it easier. So here are three supplements that do have some great evidence supporting the effectiveness to help break down certain carbohydrates. So the first one, and is very well known, the lactase enzyme supplements help individuals who are lactose intolerant by breaking down lactose in their small intestine, allowing for absorption. They need to be taken with as soon as you begin to eat dairy, foods, or lactose containing meals or snacks. If you are relying on broad spectrum digestive enzyme supplements, you should check the amount of lactase contained in the product, which should be between 6,000 and 9,000 acid lactase units, because you need at least 3,000 units to digest up to 20 grams of lactose. That's equivalent to 1.5 cups of milk. So these type of supplements worth a try if dairy products are the culprit of your digestive symptoms. Vino and similar enzymes can target the fructans and galacto-oligosaccharides that are found in many fruits and in grains and legumes that we usually consume. So those are like bread, rye, barley, corn, even cucumbers, onions, kale, leeks. That's just, and the list goes on. So take it with your first bite. Vino and other brands also contain mannitol, which can cause gas and discomfort for people sensitive to polio FODMAPs. So if you are a person with Sjogren's who are sensitive to xylitol containing foods, chances are that you are going to be sensitive to products that contain mannitol or sorbitol. So one way to identify those sugar alcohols is that they usually ends with the term "ol." Now, I've been following Food products for over a year, and they don't only produce the digestive enzymes, but also incredible continuing education on gut health for dietitians and other healthcare providers. Food can help break down high fermentable fibers such as fructans, glucose, and lactose. It cannot help break down polyols or fructose. Fodsime is Monash FODMAP certified product, so it's a safe product. It comes in powder, and is the only enzyme intended to target and break down the wide variety of fructans found in common foods. So if you think about a slice of pizza that contains cheese, like your mozzarella cheese, and it contains vegetables. I like vegetable pizza, and you have the wheat dough. So there is a combination of high FODMAP products there. This particular enzyme can target different products there. It can target the wheat, it can target the lactose, right? It can target the fructans, like if you add onions or even garlic. Whereas if you were to use the other products, so you'll have to take one pill of lactate and one pill of Beano. So I just love the convenience of it. Let's see if I could. Oopsies. Okay, right here. So here's how it works. You could just put the powder, and as a good Colombian, I love my rice and beans and cheese and nachos. And so this is great because it works in all those types of different foods. Now, while most enzymes are sold as capsules or pills, a powder format is more effective to support maximum FODMAP breakdown. Now let's talk about digestive enzymes with questionable evidence. So here, we're going to review at least 4 or 5 that you can easily identify at your health food store. So this is a very popular brand, New Roots, plant digestive enzymes. So they market that they support digestion, reduces post-meal discomfort, improves nutrient absorption. And remember, unlike prescription pills, OTC digestive enzymes or over-the-counter digestive enzymes are an unregulated market. The enzymes contained in pancreatic enzyme replacement therapies are usually dosed in USPs. So typically, an adult starts with 25,000 USP per meal, but in this particular case, there's no conversion of the food chemical codex available for USP units. So you don't really know how much you're taking and if it's either effective. You don't know if the enzymes are going to survive the acidic environment. And also, just the lactase is a really good example that it contains 544 FCCs. So remember that you need at least, if it's like a broad digestive enzyme product, should contain between 6,000 and 9,000 acidic lactose units. So we don't know what is the conversion of those FCCs. So what is actually working? But Overall, like plant-based digestive enzymes are typically safe. If you really want to give them a try, always just follow the directions, like the product's direction. It's usually suggested to take it right before the meal. They can be costly, and I would say that it's better to try enzymes that target identified troublesome foods. Then this is a great example that natural is not always harmless. Pineapple and papaya have been like widely promoted as the natural food enzymes, specifically for components like bromelain and papain. They are protein digestive enzymes extracted from the stem of pineapples. When it comes to the bromelain, and papain is from papaya. They had not been broadly studied as a human digestive aid, and with pineapples specifically, do not take if you're allergic to pineapple latex wheat. So there's a wide variety of reasons why you should not take pineapple, and actually find that many patients with Sjogren's can be sensitive to like grass pollen. If this might be possible, that may activate like the mast, can produce a mast cell activation syndrome. So I will skip it if you are at risk of those things. They also may have a mild blood thinning effect. Skip it. Better off eating the actual pineapple and papaya. 1 cup of pineapple chunks and papaya chunks are really high in fiber, and they're quite effective. High in potassium and vitamin C. Papaya contains vitamins and antioxidants that can actually help eye health. The pancreatin supports this supports digestion and is an unregulated alternative to prescription digestive enzymes like PERT, but it's administered at very lower doses compared to PERT. There's no regulation, so I would just say skip it, because the majority of bloating occurs to the poor absorption of fermentable carbohydrates. Excuse me, got right there. Bile salts. Here is really what I thought about this supplement, that it could be a bile acid salts or bile acid sequestrants. And why is this important? Because bile salts may not be absorbed when the gallbladder is removed, leading to a buildup of bile acid causing what is known as bile acid malabsorption diarrhea. But it could really happen to anyone, right? Sometimes when a low FODMAP diet is not effective to manage diarrhea after ruling out other gut disorders, bile acid malabsorption is suspected. So there is a specific treatment for it, like bile sequestrants and a low fat diet. So again, this is just a mix of all supplement digestive enzymes. This one is like bovine source or like cow source. But again, the USB units are quite low compared to the pharmaceutical version. And this is like the one that really makes me giggle, because it claims to help digest wheat, dairy, and other grains. And that's not really the true. What it helps is it contains enzymes that target fructose, lactose. So in that case, I would just go for like FODzyme. And it's very misleading, because the only available treatment for individuals with celiac disease is a gluten-free diet, and avoiding gluten altogether may relieve symptoms for individuals with non-celiac gluten with sensitivity. And there's no regulation on the amount and number of enzymes. I just saved your money. So if you didn't receive, you get the email sequence, please let me know so I can send you all these additional information to support your knowledge. And now my final key takeaways is that Sjogren's is a systemic disease that is not limited to dryness, as I've been explaining since last month. Can cause a wide range of gastrointestinal manifestations. Up to 10 to 30% of individuals with Sjogren's may develop EPI, so seek further medical attention. Digestive enzymes should be taken based on individual food triggers, but most importantly, you should really look into what is the root cause of your digestive symptoms. Do not